Folks, today we're going to talk about heart disease and why calcification. Why do the coronary arteries that surround the heart get blocked with calcium? I started seeing this in athletes in 1984 and been following it ever since. My journey started when I was working in the emergency room, when I became a paramedic, and after that I started working in the research lab with some leading cardiologists. And even today, some of the best cardiologists in the country don't have answers. So I want to take you on a journey physiologically on why an athlete will have coronary artery calcification, why they may have soft plaque rupture from the journey that I've been on over 30 years. I think you're going to find it interesting. Studying the research from Dr. Sapolsky, who wrote the book, Why Zebras Don't Get Ulcers, we understand that stress can damage the coronary arteries. Elevated cortisol and low testosterone can actually damage the wall of the arteries called the endothelial lining. So looking at this at 60,000 feet, this is what this poster will paint a picture for you. As you can see, chronic stress shuts everything off like a clock. Elevated cortisol, when you're in that flight or flight response, can cause constriction and dilation of the arteries. So when you're under chronic stress, you lower your testosterone, your thyroid levels, you lower multiple metabolic markers in your body. So if people say that stress doesn't cause heart attacks, yes, they can. Some people say you can't die from a broken heart. But in essence, when you're going through a really bad breakup, your cortisol to testosterone ratio is out of balance, and it could damage the endothelial lining, causing vasoconstriction. So we know the mind and heart have a connection. Part of this stress process is understanding how stress, physical, mental, and emotional stress, impact your heart and your coronary arteries that surround your heart. You may be an athlete that's racing with a heart rate of 180, or you may be an executive that's going through a divorce. Both can cause damage, folks. This is looking at it from 60,000 feet, and we're going to drill down a little deeper. Just a little recap. We know that physical, mental, and emotional stress can cause calcification. So your lifestyle, your exercise, the job stress you have, relationship stress that you have can also assist in blocking your arteries and causing calcification. We got to get our heads around that. Now we're going to move into what happens actually on the coronary artery level. If you were diagnosed with high calcium, this is what we're going to look at, okay? This is what your cardiologist doesn't have time to look at, but this is what we drill down on. This is what we do for our clients with high calcium. We know that elevated insulin is a growth hormone. When insulin is elevated from simple carbohydrates, or if diabetics are injecting insulin, it actually can block the arteries in the heart. That's proven, that's a given, there's studies out on that. Hypercoagulability, the thicker your blood is, can also damage the lining of your arteries. If you're taking testosterone and it's not at the right level and your hemoglobin and hematocrit go up from your red blood cells increasing from testosterone, one of the benefits, but if your blood gets too thick, it can damage the lining of the arteries or the endothelial lining. Shear stress, every time your heart beats, it's equal to lifting 70 pounds off the ground 1 foot. As the blood flies through the aorta, it may nick off a piece of the coronary artery here, or the endothelial lining, and then it becomes cracked. This is where the calcium forms. Also, if you think about a river, when a river bifurcates and it splits, goes right or left, as the blood flies through here, the arteries can be blocked with calcium right at this area right here. It's called turbulence. So the turbulence from the blood can shear off levels here. Now, we even found this in children. You know, the arteries start to be being blocked in children at a very young age. Why is that? So we look at elevated blood sugar, another damaging the endothelial lining, so we've got to keep your blood sugar down. Oxidative stress, when you cut an apple in half and that apple gets brown. Okay, that's called oxidative stress. That's one of the things we test for with our patients with high calcium. We look at low testosterone and homocysteine. Low testosterone, the arteries that surround the heart, when testosterone is at the right level, it releases nitric oxide and keeps the arteries dilated. This is one of the beneficial effects that testosterone has on the coronary arteries. Homocysteine, when that's elevated, that's an amino acid that could also damage the coronary arteries. We know through history, children with elevated homocysteine levels have to have triple bypasses before they're in their teens. This research is out there. So a lot of cardiologists don't look at homocysteine levels, and even if the homocysteine levels are elevated, the cardiologists really don't know what to do because they're not trained. Guess what brings down homocysteine levels? A certain ratio of B vitamins. How about that? We actually look at the nutrition, folks. Estrogen deficiencies have a lot to do with the coronary arteries. Again, elevated blood glucose, low growth hormone, LDL oxidation. The LDL particles, we do subfractionalization. Think of cholesterol as a large beach ball. And underneath cholesterol, you've got hard marbles. Those marbles are what we measure. Those marbles can penetrate the endothelial lining and start to block the arteries, okay? So LDL oxidation, cholesterol only becomes bad when it becomes oxidized. Again, we cut the apple in half, the apple gets brown. That happens to cholesterol, that's called oxidized. So when the cholesterol gets brown, it gets sticky and then sticks to the walls of the arteries. Now remember, the calcification is a repair process. So when your arteries get damaged for these multiple systems, or if you're under stress, the body's constantly trying to repair this process, and that's where the calcium comes from. Here we have very fit athletes, marathon runners, guys that are just super fit with no chest pain, no symptoms, and their arteries are becoming blocked with calcium, folks. This is what we're drilling down on. Okay? Elevated adrenaline and nutritional deficiencies. I know the athletes that I work with, including myself. When I was a paramedic, I started triathlon training back in '84, and I started seeing these very fit triathletes having heart attacks and arrhythmias. I was in atrial fib, and I had problems with the arrhythmias back in the 84 to 96, and the cardiologist couldn't figure it out. So you can imagine, I go away to races, I meet people, it's like, wow, I got this blockage in my heart. I'm like, how in the hell do you have a blockage in your heart? You're the fittest person on the planet. Anyway, this has been our evolution. So now we looked at the systems, we looked at the coronary arteries, now we're gonna drop in on a cellular level and educate you what to do if you have a high calcium score. Now we're going to look at what happens on a cellular level. We already walked through what happens to the coronary arteries when you're under stress. We looked at the systems of your body that the cardiologists don't look at for calcification. Now let's look at this on a cellular level, okay? Endothelial cells, the cells that line the coronary arteries. We know that a lot of the people with calcification don't have any symptoms because the artery has 3 layers, and one layer is a muscle. A lot of times the calcium forms inside this area. And why is it forming in there? Why are these breaks, why are these things happen? Well, on a cellular level, we know the endothelial cells, or the vascular smooth muscle that lines the artery, the endothelial lining, can become damaged. So apoptosis, that's cell death. That's a word for cell death. A cell will divide about 40 to 60 times, and then the cell dies. So is there a lot of turnover on the cellular level? Leukocyte adhesions, that's basically your immune system, your white blood cell count going to the area of the damage and blocking the arteries. So your immune system has a lot to do with protecting your arteries and also blocking the arteries that the cardiology community is not yet aware of. Lipid deposits, we know when LDL, when that cholesterol becomes oxidized, when it becomes sticky, that's part of the spackle that goes on the wall to fix the artery. Okay, vasoconstriction, when you're under stress, physical, mental, or emotional stress, or you're nutrient deficient, your veins and arteries will constrict and your blood pressure will go up. So again, this is a multifactorial approach on a cellular level. Vascular endothelial smooth muscle growth. Once the damage happens, you could actually grow new tissue on the endothelial lining. And obviously a thrombosis, there's something called the soft plaque rupture where you could have a little blister on the coronary arteries, and that blister can pop. That's called the soft plaque rupture. That happens, a lot of times that happens to the athletes that I've worked with across the United States. They have no calcification, and all of a sudden they have a rupture because all the exercise that they're doing, they're training at a high heart rate, they're banging in the carbohydrates, they're exercising sometimes 20 hours a week, and it's damaging the lining of the arteries, and that repair causes a little blister, and that soft plaque rupture is what causes the heart attacks. Now, folks, I've sat down right next to and talked to hundreds of cardiologists. They're not trained in how to customize this approach. Our benefit, what we bring to you if you have a high calcium score, is we immersed ourselves in 2 different fields, endocrinology, cardiology, nutrition, and this is how we came to develop this program. Okay, folks, now, again, we're gonna drill down and look at this on a cellular level. So I'm gonna explain the basics. So what goes on the mitochondria? The mitochondria are the energy packs in each cell of the body. So the lining of the endothelial lining where the calcium is forming, we're able to look now on a cellular level and plug in interventions that could affect the mitochondria on the lining of the arteries, okay? One of the tests that we developed is something called asymmetric dimethylarginine, and I know that's a mouthful, but we actually could measure how much nitric oxide is being released to keep those arteries dilated. This test, the cardiology community is not aware of, and this is one of the tests we bring to the table for our clients that have a high calcium score. Because listen, if you get diagnosed with a high calcium score, it's not a death sentence. We want to plug in an intervention for you. And I know a lot of the cardiology community doesn't believe we could turn this around, but we could stabilize it and protect it and help you with collateral circulation, build more arteries around your heart to keep you in the game. And for my clients, I want them to go to bed at night and not worry about this, because the worrying could also exacerbate the situation. So let's look on a cellular level. Our body on a cellular level, this is how our body creates energy from the mitochondria, and I have a video on that on my YouTube channel. The mitochondria, this is the Krebs cycle. So the body utilizes fats, carbohydrates, and protein, and what we realize is when the body uses high amount of carbohydrates, it creates a lot of smoke or free radical damage. To protect the coronary arteries, and this is a paradigm shift that's happening right now, we want to elevate the fat content in the body, go more to a ketogenic diet, and implement intermittent fasting. This will allow the coronary arteries, the endothelial lining, to rehab themselves. Now, I tell this to cardiologists, and they think it's crazy because they're conditioned to give everybody statin drugs. We know now that the statin drugs, through research, damage the mitochondria on a cellular lining. So that whole billion-dollar industry of cholesterol is bad, we need a statin drug, is completely changing, folks. It's completely changing, and this is what we're bringing to the table. I've got 30 years in this of treating patients, okay? Trust me when I tell you, good care is right around the corner. So we want to increase the fat level, we want to increase the protein level. Here's all the vitamins that are involved. We check what's in red, we test what's in red through a urine sample, and we replace the B vitamins, the carnitine, depending on what each patient needs. If you have a high calcium score and we're looking at you on a cellular level, we could actually implement a nutritional program that is not done in any cardiology center in the United States yet. We could give you the nutrition that's going to impact you on a cellular level and stop the progression of calcium to help protect and dilate your arteries, build collateral circulation around your heart. So if you do have a heart attack, you have other arteries supporting the heart muscle so you don't have dying of the heart muscle. Okay, I was trying to figure this out in 1975 in the emergency room, and this is what I've come to develop, folks, because I want to get people answers at the end of the day. Drives my business partners crazy, but I'm going to open source this because heart disease is still a problem in this country, and this protocol is going to change the way we look at heart disease.